Pastor Jones,
Present.
Dr. Hans, Miss Newman, Miss Root. Here. Miss May provided notice that she wouldn't be able to attend. Miss Woodruff,
Here.
Dr. Giles, Mr. Landsman.
Here.
So right now we have overall board quorum. We do have quorum for the finance committee, but let me look at the policy management. We have 50% of the policy management committee.
Question. Do we have any action items on the policy side that require approval tonight?
No, we don't.
Okay, so then having or not having a quorum is immaterial, correct?
Next is our first opportunity for public comment. Do we have anyone on the line that would like to make public comment?
We do have some guests online. We would like them to raise their hand, use the raise the hand option if they want to make public comment. That will help us identify them in order.
There's one person online with their hand raised. If you want to go ahead and introduce yourself, and you have 3 minutes for public comment. Salim, you can go ahead and speak. Salim, if you are speaking, we can't hear. Can you please unmute your mic?
Trish, can you unmute your mic and test so that we can make sure the audio is working externally, please?
Sure, I can hear you guys.
Thank you. We can hear you as well.
He might need to turn up the volume on his mic. Even if he's not muted, it may be turned all the way down.
Salim, we're going to ask you to turn up your volume.
He did put something in the chat about his mic not working and a phone number that he could call into.
That is the only person online right now. While Salim is working on his audio, we may want to entertain public comment in the room.
Is there anyone in the room that would like to make public comment at this time? Not seeing anyone. What do we do? Come back to him? Okay. We'll come back to Mr. Karim. Is another hand? Oh, Lynn Magnety.
Hi. I actually work with Salim, so I maybe can kind of touch base about what he wanted to convey to everyone. Um, I was originally going to jump on at the other board meeting, but I thought it'd be a good idea to just chime in here. Um, I represent New Gateways. We're a skill building program in Oakland County. And I also work with the Oakland Provider Alliance. And I just wanted to share my disappointment of how OCHN has handled the 85-cent rollout of the wage increase for our DSP workers in Oakland County. Um, because OCHN rescinded that dollar that was given in January and pretty much made it a wash. And we're not able to pass along any additional wage increase to our employees that they were expecting last week. And it was just very disappointing. And I really hope that OCHN will reconsider how they're handling the situation. It really brings the morale down for our DSPs. We're, struggling as it is to keep our workforce intact. And there's got to be a better way. So I'm asking all of you to just reconsider that act because it's not acceptable and it's very disappointing. Thank you.
Thank you. You'll be getting a response in writing from our customer service department. And Salim is still not able to speak. We'll come back to him. Now it's time for the Finance Committee to take their portion of the meeting. Thank you. I'll entertain a motion to approve tonight's agenda.
So moved.
It's been moved and seconded. Is there any discussion on the motion? Hearing none. All in favor?
Aye.
Any opposed? Motion carries. Okay, now we turn it over to Finance Committee.
Thank you. Our first item of business is a financial review through the month of August 2023. Patrick, welcome.
Hi, I'm sorry, is my microphone working?
Go ahead with your public comment, Mr. Siam.
Oh, yep, I'm sorry about all that. Is my microphone working now?
Yes.
Yes.
Oh, okay, thank you very much. Yep, I'm sorry that took so long. I just wanted to basically talk more about what Lynn was bringing up, just about both the cost reimbursement for day programs, also the 85-cent wage increase. It really does make a difference to our staff, especially when they were following the news about whether or not it was going to be passed, and then they saw that it was passed. And then for it to not be enacted, for it to not make an actual difference in their paycheck is just really disappointing. And we just really need to keep the staff we have because the relationships they form with our people are so important. So if they leave, it really does have a big negative impact on our people. And then for the cost reimbursement, a lot of day programs just wouldn't be able to survive if they don't get that. And as you know, you folks already know that day programs are just so important to our people, both for not just having a great life, but also living longer. The statistics all show that when there's a day program who can also take care of our people, not just parents, not just group homes, they end up living longer, happier lives, healthier lives. And that's all I wanted to say. Thank you very much. And sorry for all those technical problems.
Thank you for your comments, Mr. Sileo. You'll be receiving a written response from our customer service department.
All right. Thank you. Patrick,
Okay,
the floor is yours.
okay, we're gonna start with our financial statement, report, starting with, slide number 1. It shows, MDHH as payments. We've been showing a slight increase. We've been showing an increase in revenues in the previous months of May, June, July, and August. We did, however, budget for these increases. Um, Revenue was accounted for in our BA2 projections. And so we talk about is the eligibles. Eligibles has remained consistent throughout the year. Coming from the Public Health Emergency Act, reduction of CCDHC. We're experiencing rate changes, as we know. We're anticipating 21% decrease in the FY24 and accordingly. Know that on October 17th, our consultant is coming to show this is not just the OCHN problem, or it's not just related to OCHN, but it's adjusting to shifts in the eligibility, and it's throughout the state. 3, it talks about the actual versus the accrual. This is our asset totals. As you recall, in March, we presented a budget that showed an $8.9 million shortfall. This process, we removed all of our accruals out of our to reflect real-time payments and real-time actual expenses paid, and it gives a more realistic view of what our actual statements reflect. We did, however, remove accruals out of our reporting, and it shows more realistic and actual, real-time, actual expenses paid. Slide 4 talks about our liabilities. All our categories went down, as you can see. Vendor payables, due to state, employee payables, long-term debt, and it just shows that OCHN is paying their bills timely and regularly, gone down substantially over the during the year, and as a result, you see a $10 million decrease in our liabilities because we paid those debts down. Slide 5 talks about net position. As you know, we overspent in Medicaid. We pushed out dollars to providers to ensure that during the continuity of care was continued during the public health emergency. We ensured that provider stability payments were pushed out, and cost reimbursement was done in order to make providers sustainable during the pandemic. All our behavioral health services, including SUD, we made sure all of the providers were well funded during the pandemic and the public health administration. The SUD, all of our funding shows a $7.8 million shortfall as of year to date, from October 1 of 22 through August 31st. Next slide talks about revenue. It compares year to year. FY '22 versus revenue received in FY '23. As you know, our revenue continued to be higher in all of the various funding sources, particularly Medicaid, which includes also CCDHC. Although we received additional revenue, we also pushed dollars out to the same tune of what we received them. All other investments, other income is all other investments, includes income, investment income, and rental income, and various other forms of revenue that we receive. Slide 7. Is comparison. We continue to push out more dollars on services in an effort to pay for cost reimbursement and to stabilize pay stability payments and staffing and DCW, direct care wages, and premium pay. We made sure that all of the dollars pushed out and the providers were made whole during this time. Our expenses show that we overspent Medicaid because those are direct services that go directly to the services provided. It didn't. Our expenses didn't increase in no other capacity any greater than in a service capacity. And we feel good that we know that they did go directly to providers for services that OCHN contract with. Next slide. Net income per BA2, we budgeted for 8.9 million shortfall. We're currently showing a 7.9 million shortfall after 11 months of activity. All of this is real-time data. Any accruals that were previously recorded in the prior year are no longer showing in this year's data. And so if you compare net income year to year, sometimes it may seem that we're not on track to objective and goal, but however, we know that 7.9 is kind of what we budgeted for, and so I was glad to know that we're kind of right in line with what we expected to be at this time. As of 8/31, a lot of special funding, such as stability payments, and we know that a lot of the discontinuation of the cost reimbursement models, and we pushed out all of the additional dollars during the public health emergency. Now that that public health emergency has ended, OCHN holds the risk for the network, and we hold the risk for it. So we have to ensure that we're good stewards of the public dollars and that we're doing our fiduciary responsibly and making sure that that we're balancing the budget and ensuring that services are provided the best models and methods that we have available. So in most cases, like I mentioned, we did overspend in Medicaid. Our budget for administration still remains less than 7%. And that's great, considering that we pay providers 12.5% for their administration budgets, and we managed to have only a 7% admin rate. And that means that most of the 93% of the dollars that we receive through capitation and various funding models, that 93% of it they're pushed out to services that's provided. There are a few things I wanted to point out, in the, go to the next slide, I'm sorry. Talks about the top 15 providers. They pretty much remain consistent throughout. That's pretty much most of our presentation for finance. We know that we're showing a 7.9 shortfall as of 11 months into this fiscal year. One more month left in this. And so we're happy to report that we've tightened our belt as much as we could. We tried to do everything that was necessary to provide services and to continue to ensure that that we're pushing out dollars to providers as needed. And that's all I have to present today. I'm sure there's some questions, and I will answer them to the best of my ability.
Thank you, Patrick. Any questions on the financial? Yes, okay.
This hasn't come up in a while, but I was just wondering, is this building fully leased?
Is it fully leased?
Yes.
Oh, no, we have tenants that are that's occupants in this building. We have space available that's not built out, but everything that's built out is occupied.
Okay.
I believe right now we are fully leased at the capacity that's built out.
Well, are we still working towards getting other renters?
Well, you know, during the pandemic, most people were working virtual, and a lot of people were getting away from the brick and mortar and going to more of a hybrid type of setting. So there was not a lot of activity around real estate and marketing for properties. And so we can revisit that as the public health emergency has ended. Maybe there's a increase and an uptick in the number of people looking for space. But we did experience a drought where there's no one was really knocking on our doors. And so.
Thank you.
Yes.
I just wanted to add too that we are looking at our first floor and expanding our actual capacity to provide some of those direct services as well. We know right now we use our first floor for the autism evaluations that are done here for ABA services, and we're looking at other ways that we can specialize assessments for those youth that need more than just the basic assessment that many of our providers may not specialize in doing. So we're looking at ways to expand our use here as well and give families more options.
Thank you. Anyone else have any other questions or comments? Yes, Pastor Jones?
Yeah, thank you very much, and thank you for the report that you made. I wrote 3 things down, which I'd like to see where you are on them. You mentioned in the report, number 1, good things you've done, admin, investments, and liabilities. Okay, those 3. And I was wondering, as you looked at the report now, and we're 1 month out, numbers are already coming in, what are your 3 areas that you feel you really need to improve on, looking at the fact that we're going to end a little over $7 million, right? Shortfall. So, and as you say, here are 3 areas that I feel we really need to improve on. Of those 3, your personal objective, to say, you know what, this one we're going to do. You know, and maybe it's hypothetical, maybe it's something that you've been looking at as you watch the flow of the numbers. for that great achievement. I'll give you that. And your department, just for that, especially the numbers that, when I first came, what the numbers were and where you are. And now your report says, here I got 3 that where you can wave your flag on. But then when you look at it, so what areas could we improve on so that the next fiscal year, I am closer to not only budget but overachieving, and what would be your personal objective to make that happen?
Well, first of all, we wanted to make sure after having 3 years of deficit spending, 3 consecutive years of deficit spending, we wanted to make sure we presented a balanced budget that showed opportunity to refund some of our ISF and provide dollars to, because if we're going to hold a risk for the network, then there have to be some funding available in the case of the next pandemic or the next emergency that comes up. And if we're not prepared for that, then we wouldn't be able to provide stability to the network. And so we want to make sure that want to refund our ISF, and that would be one of the things that I look at.
And would you say that would be maybe your personal chief objective?
Well, personally, I'm not the CEO. From where I sit, I can speak candidly about some things, but it would be a effort for the executive team to, make. It's probably most of it is probably in our year-end plans and our the plans that we put out as an organization. And I believe most of our plans that we have are out for 3 years. They can tell you what's on the agenda. And so I would be selfish if I just had a financial objective without considering the network and whatever ideas the CEO and vision she has for the organization, along with the other chiefs. And so if you ask one department how they, if you ask the budget and finance, obviously it's going to be about managing the budget, because that's what we're charged to do as fiscally responsible. If you ask clinical, they may want to provide additional services and programs. If you ask, and so based on what you ask me as a finance person, I want to make sure the outlook looks good for the organization and that we're fiscally sound and we're providing services at the right time, place, rate, and so that people can receive services.
Thank you, sir. Appreciate that.
Okay. Thank you. Anyone else? Mr. Young?
I'm going to bring us back down to the numbers, Patrick. So it looks like, as you've said a few times, the real-time accounting versus the accrual has us tighter on both accounts receivable and accounts payable. In the other category, the due from other governments, I'm assuming because we're doing real-time and no accruals, that's a timing issue now versus comparison to past year?
Well, most of the majority of the changes in due from other governments is we received approximately $8.3 million from prior year receivables, of which $13.7 million was for our FY19 MDHHS cost settlements, which totaled approximately $5.1 million. So that caused our due from other governments to go down because we were able to do those cost settlements and receive that additional revenue.
So prior year cost settlements are in this line item as well, which, okay, all right, that makes sense.
And then our CCBHC settlement presented last month has decreased by approximately $3.8 million. It went from approximately $3.8 million to $680,000, which also presented on the statement of revenue and expenses and changes in net position. If you look at that, you'll see that change reflected in our changes in net position. And so because we were able to receive those due to other government, it caused our, we collected on some of those and it flowed into our net position. As of August 2023, our prior year CCBH supplement, we received 5.4 million, and it's reflected in these totals as well.
Okay. So prior year cost settlements can go back sometimes multiple years before it's cleaned up, correct?
Yeah,
Okay.
they can go back. I just completed FY20's cost settlement, fiscal year 20, and this is 23. So
Right.
generally about 3-year lag that we
Okay.
settle with the state. We settle with the providers 105 days after year end. They submit us their audit, and then we, based on that audit, we cost settle.
Mm-hmm.
But when it comes to the state MDHHS, we're basically 3 years behind on that cost settlement, and that's where a lot of that came from.
They're 3 years behind with settling with us.
Yeah.
Okay, thank you.
Anyone else? All right, thank you for the report. I think you're also going to touch on the Oversight Policy Board recommendation that was made recently.
Yes. So the Oversight Policy Board recommendation, we met, I believe it was 2 weeks ago, in the Oversight Policy Board meeting, and they approved the additional spending. They approved FY23 PA2 budget funding expenditures in the amount of $3.8 million. They also approved the reallocation of Medicaid and Healthy Michigan fund sources to PA2 fund source in the amount of $12 million. And then also FY24's PA2 expenditures in the amount of $4.3 million.
So we'll see the when you report next month on the September year end, so to speak, we'll see the benefit of the reallocation of the Medicaid and Healthy Michigan Fund.
Well, those dollars, when we really look at it, we're really just a fund source, and it's how funds are applied. And so we wouldn't really see the benefit of that until our cost settlement and year end.
Okay.
And it'll show.
But it's being injected into the cash flow is what it is occurring.
And I don't want to, but there's no additional funding for the $12 million. It's just a reallocation of funds.
Right.
It went from a restricted,
right,
so that we didn't have to use our unrestricted.
Okay.
Yeah.
I get it.
Yeah.
Okay.
But there's no additional. I wish it was, though.
All right. Okay. All right. Any questions on that? Yes.
So that shift with the fund sources, not just for the 2023 fiscal year, but we're also doing that for 2024 as well? That's what number 3 on this list shows?
No, that's the 24 budget. Yeah. That they approved their budget, and that's what
Right.
amount they
It's
approved it
separate
for.
from the number 2.
Because in the past, we hadn't presented budgets to the Oversight Policy Board, and so we wanted to make sure we were being transparent with them, and we're not just going to come to you when we need to use PA2 dollars, but we want to report to you about on a monthly basis or quarterly basis whenever they have their OPB meetings. So that was just being open and telling them what we were expensing for FY24.
Okay, so So now I have a question that might be for you or probably our CFO or for Dana. Didn't we, at our last meeting, approve our overall budget for the full year? And so this is their approval of their portion of the budget?
Yes. So just to clarify, the number one, ratifying the approval of use of the PA2 dollars, those PA2 dollars are being utilized for fiscal year '23 at the amount of $3.8 million. But like Patrick said, in previous times, it wasn't clear to that Oversight Policy Board that we actually needed their approval to use those in that budget. So we went back to make sure that we got the approval. We also went back to actually ask for the reallocation of the number two, the PA2 dollars for $12 million, and then going forward for future use of PA2, we got the approval we should have gotten anyway. So that's all the part of our full budget, but now the distinction is clear of where those dollars are going to be utilized and the amount of those dollars.
So when we approved our budget a month ago, we should have said subject to their approval of their portion of use of PA2 funding, maybe, I don't know.
I think we should have had it done already, but
Yeah.
under the circumstances we were,
Right.
like number two, we know we needed to get with the board, and really it should have happened before we had our final approved, but they had some scheduling challenges and things of
Right,
that
they
nature,
missed
so.
them.
They
I remember
did
they had to postpone a
They
meeting
had to
because they didn't
postpone a
have
meeting.
alcohol.
Right.
It would have occurred then, yeah.
Right, but also they meet quarterly, we meet monthly, so it makes it hard to.
Exactly.
It sounds almost like for next year, to circumvent, or so that we don't run into this, we might have to get their board approval in June or July, just to make sure that
Yes.
the PA2 funding for 2025, I can't believe I'm talking about 2025 already, but we would need to have that well in advance, just because of the timing of their meetings.
And
Unless they have a special meeting for budget, which
And
we could do, couldn't they?
Yes. I would add too that they need additional board members. I think they need at least one more board member. And so there's always a challenge of trying to get additional board members. But I think if we could promote that better in this meeting, we probably can get some interest.
Okay, thank you. Thank you guys for clearing that up for me, because it was a bit confusing. Thanks. Okay.
Any other questions on the, I'll call it the supplemental report on the Oversight Policy Board? There being none, Patrick, thank you very much.
Thank you.
All right. We do have 3 items for the committee on contractual obligations. The first is the Relias contract. And that is a extension of the Relias contract for 3 months for $45,000 until we can fully implement new software, the Vital Data Technologies health management software. I don't think there's too much mystery about this, but go right ahead.
Nasser Dost, Chief Data Officer. So we moved from one system, this system used to generate the HEDIS measures, which is like performance measures for healthcare. The HEDIS is a product of NCQA. This vendor is not NCQA certified, so we moved to a new vendor called Vital Data Technology. But there is 2 caveats here. Number 1, we need to have a full year of data. So the contract ended in September, and the HEDIS measures are running on a calendar year, or most of them run on a calendar year. So we want to have a full set of measures and data till the end of the year. That's number 1. Number 2, the new system, we are still in the working phase with the vendor to tighten up some of the measures and the data elements and things like that. So between both of them, we are asking to extend this contract for another 3 months. On another note, the current vendor contract, we saved about $59,000, $60,000, something like that in travel time because they are based in California and we didn't use this money. So that can offset this cost. Thank you.
Thank you. Anything else? Okay.
I think that covers
Lisa,
it, yeah.
You concur in the summary?
I do, yeah. And I guess the only thing, just contextual information would be that, a lot of our integrated healthcare initiatives are, supplemented by grant funding too. So we have historically been able to and plan to continue to use, grant funding to support some of these efforts.
Okay, thank you. All right, members of the committee, any questions? Do we have a motion?
I had a quick question.
Oh,
Just, the months, so you said it was 3 months, so it would be October, November, December?
I think so, yes.
Yep, okay. Because you said it ran in January, was it was the full year, right? It runs on a January year?
The HEDIS measures run on a calendar years, and
Yeah.
the contract ended in September.
So the 3
So-
months, yeah, would be October, November,
Exactly.
okay. I just wanted clarification, thank you.
All right, we have a motion by, John, do we have a support? Support. There's no further discussion, can we have a vote, please?
Mr. Young?
Yes.
Mr. Torres? Pastor Jones?
Yes.
Mr. Cohen?
Yes.
Motion carries.
Okay, thank you. Thank you very much. All right. Our next item is the contract with Jefferson Wells for our Medicaid verification audits, and Marquita Massey is here, so go right ahead. Thank you very much.
Good evening, Marquita Massey, the Director of Quality and Regulatory Compliance. I am here to request an extension on our contract with Jefferson Wells. Jefferson Wells is our vendor that completes our Medicaid claims services verification audits. What that means is essentially they do a retrospective review of paid claims, ensuring that services billed were performed by qualified staff, that they're documented appropriately, and that it's authorized in the plan of service. This would be our 3rd year of contracting with Jefferson Wells, which throws us into the threshold of being over $100,000, which is why we are requesting an extension of the contract. This is an activity that's required with our contract with the state, and it's also a risk management strategy for our organization. So the contract amount has not changed in the past 3 quarters, and we've been satisfied with the work that Jefferson Wells performs, and we've been able to expand the number of claims that are reviewed for this activity on an annual basis.
And are you satisfied with their work?
Yes, we are satisfied.
Okay, that's important. All right. Do we have any questions from
yeah, a quick question.
committee
I'll
or
make a
anyone
motion.
at the meeting? Go ahead.
Does this also, if someone is Medicaid and say Medicare, does it note that you know what I'm asking?
Yes, if somebody is dual eligible, yes,
Yeah,
they would
thank
be
you. I
pulled
couldn't-
to,
yeah.
yes.
All right. I move that we, move this forward to the full board next week.
Motion by John Young. Supported by Mr. Are you, okay. Are you supporting the motion?
Yeah.
You should support the motion to get to.
Okay, yeah, support.
Okay, supported by
so that-
Mr. Torres, okay. All right, go ahead.
So when I look at this, what they do though, I see that they, could potentially result in the recoupment of funds. So this is a pretty important thing, right? Because if it's not done, and if it's not done accurately or with, correctly, it could potentially cost us a lot of money, right?
Yes, we're accountable for making sure that anything that we bill to Medicaid is appropriate and it's provided by qualified staff. And yes, there has been recoupment each year.
Because if there's errors on their part, that could generate recoupment of funds for us. Is that correct?
It could, yes.
Okay. Because I'm thinking about like when, with state, reimbursement of costs, like with child care fund, things like that, which is services for youth, in the, juvenile court system. We do recuperation, something similar to this with audit, and we audit the funds, and sometimes it results in the recoupment of funds. So I'm kind of thinking it in those terms. So, but I just, you know, the general point was is that, that if this is done accurately with, by the organization, it could generate the recoupment of funds. So it's an important idea, correct? Okay, thank you.
My question, is, and you bear with me because I may not be asking it properly, but I go back to, the shortfall in our financial report. And the limitations that we're having, I think we projected 15.1%, it is 21% deficit in relation to Medicaid funding or reimbursement. I may not be asking the question correctly. But we attended a meeting a couple of weeks ago, and we talked about other sources, partnerships, to pick up more of the population that may be Medicaid, Medicare eligible. And I'm wondering if this company, Jefferson, has ideas or outreach efforts that can help us to improve the amount of Medicaid applications or what have you, that would in turn increase the amount of funding that we get. You know, I spent the weekend, I was speaking with our CEO about the number of other groups that's out there trying to engage folk in relation to sign up for Medicaid, make sure you're doing the right checks and blah, 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 blah. And I know we are going to do something like that. I think we're already planning something. So I'm just wondering if the ideas that they do, with all of the years of experience that they have, do they have better ideas? Or maybe we didn't ask them one question and they said, oh, yeah, we could do this and that's going to help. I don't know if I'm asking the question correctly, but really what I'm getting at is how do we improve the amount that we reach for improved in Medicaid funding?
So that would be, what you're describing would be out of scope for this company. This is basically an auditing firm. Okay. So no, their responsibility is to review our paid claims to make sure that we've built Medicaid appropriately. So as a result of the work that they do, there are often times where there's a recoupment identified. So we are essentially reducing our Medicaid spending as a result of their work. So that's how they could, you know, relate to what you're speaking of, but that would be out of their scope
okay, because they're more auditing, whatever. Okay, all right. So that's something we have to look at in relation to my buddy that says he's got it. Or is he out there? He's got it, right? Okay, thank you.
All right, thank you.
Okay.
All right, good. Any other, yes, Ms. Woodruff?
My question, under the projected number or service impacted, the 27,000, is that the number of claims that they commit to doing per year?
That is the number of individuals served. We give them our entire claims population. I don't have that number right in front of me, but it's thousands. And from that population, they select a statistically valid sample to audit.
Okay. Thank you.
Any other questions? Yes, Mr. Lansman.
So one of the reasons we're using them, not only for verification, but also the state themselves does a sampling of our claims and encounters just to see if we're perhaps underbilling, or more likely, or perhaps they're worried about us overbilling, correct? So this is a way to be a defensive posture to make sure if we don't find anything, then the likelihood is the state's not going to find anything either.
So this is an activity that the state has delegated to us to make sure that we are handling that and following through on validating claims. But on the other side of things, from a compliance perspective, we're expected to have data mining activities so that we can look for areas where there might have been potential overbilling.
FWA. Yeah, fraud, waste, or abuse.
Mhm.
Okay, so this is the state's delegated to us, so they're expecting us to do this so that should they get federal CMS auditing, so a RAC audit, they feel pretty certain that at least the claims we processed were, or submitted were okay.
Yes.
Got it. Thank you.
Any other questions? There's a motion. Is there being no further discussion by the committee? We'll call for a vote.
Mr. Young?
Yes.
Mr. Torres?
Yes.
Pastor Jones?
Yes.
Mr. Cohen?
Yes.
Motion carries.
Okay.
Thank you.
Thank you very much. The final contract does not involve a change in finances, but is a disclosure requirement, as I understand it, with our PIHP contract with the Michigan Department of Health and Human Services. Welcome.
Good evening, everyone. Denard Haggins, Corporate Counsel for OCHN. Yes, this is amendment number 10 to the PIHP contract. There is no cost amendment here. It amends Schedule H, the behavioral health capitation rate certification, and also changes the program manager, which OCHN shall report to.
Okay. And that will be Kristen Jordan, as I understand it.
Correct, Kristen Jordan.
So, no cost changes. It's pretty straightforward. Do we have a motion?
Move to move this forward to the full board next week.
Support?
A motion and a support. Is there any discussion?
Does this need to be approved prior to that? Typically they have short. Does this amendment need to be approved sooner than that, only because typically PIHP and CMHSP contract amendments with the state usually are like very short durations, or can this wait till next week?
Sorry, I would have to report back to the board on that one, if I could.
My guess is going to be it's not a financial matter. It's just a disclosure. We're changing the individual who's the program manager. So, yeah. So we'll take this up at the pending approval. We'll take it up at the full board meeting. All right. There being no further discussion, can we have a vote, please?
Mr. Young?
Yes.
Pastor Jones?
Yes.
Mr. Torres?
Yes.
Mr. Cohen?
Yes.
Motion carries. Pastor Jones?
The work of the committee is complete. We've made 3 recommendations and had our financial review, so I'll turn it back over to the chair. Thank you.
Next, we'll go into our policy management portion of our agenda. And we have a strategic plan update with Megan Phillips.
We're changing the program manager. That's over, yeah. That's over a 3-year period, yeah.
Good evening, everyone. Thank you so much for having me here tonight. My name is Megan Phillips. I'm the Director of SUD Services here at OCHN. Before I get started with an update on our 3-year strategic plan for SUD, I want to first acknowledge and thank our SUD team. We can only do the work that we do with the team that we have in place. And so the amount of goals, the amount of work that they do every year, it's incredible. We had a very busy year this year. And so I always like to try to make it a point to give them that kudos. We had a lot of the work that we do, it's our normal day-to-day work, and then we have special projects that can come along that also take up an extreme amount of time. And so we would not get the work that we get done for the people we serve without them in place. So I want to say a big thank you to the SUD team, as well as our providers and our community partners. They are also a big part of how we're able to get our work done for the people we serve. And so with that, next slide, please. All right. I have broken this down into two categories. We will go over our prevention strategic plan update first, pause for questions, and then we will move into the treatment and recovery strategic plan update. Next slide, please. And next slide. Thank you. So for our strategic plan for prevention, one of our goals was to review our successes and barriers of our prevention work and to use that information to prepare for our next strategic plan. Some of the successes that we had, one of our coalitions, or one of our treatment providers, one of our prevention providers, they also do treatment as well, Catholic Charities, they were able to have their staff trained in Botvin life skills to be able to provide that program. In the past, all of it fell underneath our largest prevention provider, the Alliance. So we were able to expand out those services. Also, Catholic Charities ran a summer camp that included them providing evidence-based programming of Botvin life skills. Botvin life skills, it is not just about teaching kiddos to say no to when they're offered drugs or alcohol. It's about teaching them problem-solving, decision-making skills, as well as enhancing their self-esteem. So Catholic Charities was able to do a summer camp for children and parents. Parents attended as well. There was about 16 parents who attended the classes, and then about 8 to 9 kids for every Botvin's life skills class as well. We also had South Lyon that was able to implement Botvin life skills. Historically, they had been struggling to get the buy-in from their community to be able to implement that program in their schools. So with a lot of assistance from the Alliance and with us, and just through their own boots on the ground of continuing to talk with the community, they were able to implement Botvin life skills. In terms of barriers, with one of our providers for the health division, we had for their SBIRT, their screening brief intervention referral to treatment. They changed some processes through their front door, which changed how and when the SBIRT screenings were get done. So they fell short on outputs that they had proposed to us. So we worked extensively with them, providing technical assistance to make plans moving forward for this next fiscal year. What are outputs that can be reached, as well as what are new places, doctor's offices, places in the community they could perform the work instead of their own office in order to be able to meet the outputs that had been put forth. Next slide, please. Our next goal was to implement sustainability plans for services funded by our SOAR grants. SOAR stands for State Opioid Response Grants. We do anticipate a SOAR 4 to come down the pike. Currently, we are under SOAR 3. SOAR 3 will go, it was a 2-year grant that covered fiscal years 23 and 24. So we still have all of this year, all of this fiscal year that we just started for the SOAR funds to be utilized. I am continually talking to the state, asking for updates about all of our grant programs to be able to ascertain from them where are we looking at with funding continuing under some, are there going to be no-cost extensions for other of the grants. SOAR has been around since, forgive me, I want to say, although we're going into SOAR 4, it had a different name before SOAR started. So we've had SOAR around for, I think, about 4 to 5 years now. I don't anticipate it going anyplace. Through my conversations with the state, they have said as long as everything goes through the legislation as they should, that's why they can't ever give that, very confident, yes, SOAR 4 will happen. But they do anticipate that we should receive the funding for SOAR 4. Current programs that we have under there, we have our provider student leadership services. They are doing Botvin life skills as well as Prime for Life and Guiding Good Choices. And then also we have the Alliance, they are doing Prime for Life, the WISE program, which is an evidence-based program for elderly about being able to make good choices and them being able to advocate with medical offices about their need to make healthy choices and understand the choices that they're able to make. And then also our OEND, our overdose education and naloxone distribution efforts that we have with the Alliance. Those are our Save a Life boxes. That is probably one of my favorite initiatives that we are doing underneath the SOAR funds. They have rolled out about 60 to 70 Save a Life boxes. These boxes are located all throughout the Oakland County. They have Narcan, fentanyl testing strips, xylazine testing strips, prescription disposal kits in it, as well as then resources of where do you go for help, who do I call, and things like that. We have seen our numbers for Narcan distributed in the community. I think probably me saying quadrupled is even falling short. Our numbers have just exploded with how much Narcan we're getting into the community, which is fantastic with our OEND boxes. So all of it's funded underneath our SOAR funds. In the next couple of weeks, the Alliance will have our Save a Life boxes. We will be up to about 100. Right. Next slide. Yes.
Excuse me, are you taking questions as you go, or you want to wait till the end?
I can take questions right now.
Okay. I had a question about SOAR. What does that stand for?
State Opioid Response.
Okay, thank you.
You're welcome. Yes.
You mentioned BOTVIN,
Yes.
the program. I assume it's that it's probably evidence-based programs because they're coming through, not through the state, but they tend to support those kind of programs.
Yes.
But how do we offer those? Is that faith-based, because you mentioned Catholic Services or Catholic Charities, or is that community, because you mentioned South Lyon, or is that school districts? How do we deploy those kind of programs?
It's all the above. It typically tends to be done most of the time through the schools. And so whether it is one of our prevention providers, such as the Alliance, or one of the community coalitions, they will approach the schools and they will kind of provide them with a list of, these are the variety of programs that we can do for you. It's at no cost. It's us being able to come in. So for the most part, they are going into the schools a lot. Part of what I've been doing in this past year, in my new role as being director here of this department, when I'm going out and meeting with the provider network CEOs and saying hello and making sure to get to know them on an individual front, this is actually with the prevention providers one of the things that I've been talking about the most, and asking them, how are we delivering the services, to the kiddos? Because while I absolutely understand we have a very captive audience with the kiddos in school, right? But also, what can we do to meet them in the community? What about if the schools aren't, not as accepting, but just aren't, they might not see the benefits at times. So if we aren't able to get into any specific schools, what can we do in the community? I'm all about trying to be creative with what we're doing, and how can we get that buy-in from the community as well. I met with a provider the other day, and they were telling me one of the hard parts about keeping one of their leadership programs going is they need to have an adult sponsor of the program. And the hard part with it being in the schools is, which is understandable, right? So when I say this, yeah. If a lot of times for some school districts, for teachers, if it is not written in the contract, they are not getting paid extra for it. So for them to take on additional extracurricular activities, they're doing that at no additional pay to them. So that can be one of the hard parts about with some of the programs, if an adult has to sponsor it. And so when I was talking to the provider and they were telling me that, I said, well, but can't Johnny's mom, who is heavily involved with any type of service or heavily supports this, can't Johnny's mom do it? And she goes, absolutely. I said, well, then we need to tap into that more.
So, and that makes sense. You leveraging PTS, whatever they're called nowadays, PTSAs.
Mhm.
parent-teacher
Yep.
student associations, or school administration. So how many different school districts are we involved with that program?
With Botman, I will have to look exactly. I could
Okay.
not tell you offhand, but I will get you that information.
Because it sounds like it's a good success story for prevention.
Yes.
The other is you talked about Narcan boxes out there, and I saw one Wednesday of last week, and they look like they look like
Mhm.
the old newspaper boxes. And so I think it's great that we're just administering, or we're distributing, I should say, we're distributing all this Narcan. They're administering it upon need. Do we keep any stats on how much usage there is and refills that we have to do?
So we do, in terms of the Alliance is fantastic with their data. They just came in July, and they gave us a data update on here's our efforts. Every training they ever did before the Save a Life boxes came, they were doing monthly virtual and in-person Narcan trainings. And so they would keep track of them. We would have to submit to the state underneath our state opioid response funding. Here's how many trainings we've done every month, and here's how many Narcan boxes we've distributed, and here's how many lives have been reported as saved. So they are doing the exact same with the Save a Life boxes. Every single box, they're tracking the data, and they're seeing, and they're tracking, and they're looking at their numbers. How much are we having to refill? What are our numbers? When they find that a box is not having to be refilled too much, then they reevaluate, and they'll move the box to where there is more of a need for it. The hardest thing to track is the reported saves. So on the Save a Life boxes and on the, I can't remember if we put them on, if we asked them to put them on the Narcan boxes themselves, but on the Save a Life boxes, there's a QR code that a person is able to walk up to, take the Narcan out, scan it, and it's going to bring up a map of all the Save a Life boxes, as well as a ton of resources for the person, as well as a basic overview of how to administer the Narcan. And that is where they would report a life saved if it was used. So that's always the hardest part. We have to rely on the person who took it to report that.
And I'm not too worried about that aspect of.
Yeah.
I mean, I like the idea we're saving lives, but we are making it risk-free.
Yeah.
So tracking that is hard, but ROPs, EOQ, refills.
Yeah.
Is another way of perhaps tracking success of the program.
Well, and I tell you what, one of the things that I like most about the boxes too is it's low barrier. I personally think that even though it is free, if someone is tasked with having to walk into a pharmacist and even just ask for it, I think whether one, it's the shame of them being addicted themselves, they don't want to feel that shame and ask for it, or two, if it is their family member who's addicted and they want to carry it, they feel ashamed. And I think that's what stops a lot of people a lot of the times with moving forward with a lot of things with SUD. So with the boxes, they're a little bit, you don't have to tell anyone that you're grabbing anything. And I think that's part of the reason why we're getting so much of the Narcan and the testing strips out there, because it was specifically designed to be low barrier. So that way anybody can walk up at any time and be able to take stuff out.
And I just realized every time I come into this building, I pass the box that's at our
Yep.
building. So I actually see more than one.
Yes.
So board member Sarah May isn't here, but I have a feeling she would like it to be asked if you feel like northern Oakland County is being covered for these boxes.
Northern Oakland County is, and it's an area that we continue, and I should say we because I'm always talking to the Alliance about ideas and what do we do moving forward. Sometimes, the northern part of our county, or any part of our county, there are simply some communities that can sometimes feel that they might not have a high need, even though we might feel as though there's a high need. So we're always trying to have those conversations with them. And even if it's not felt as though there's a high need, here's how it can benefit your community. So absolutely, that's one of the things I suspect, and I am going to be meeting with the Alliance soon, and I can't remember where all 60 boxes are right now, so forgive me. But I know that part of when they rolled out the boxes is they first looked at where is the immediate need, and that's where they started saturating the areas. Because we didn't know, we started off with a very small budget. I shouldn't say very small, but I think we started off, our budget was somewhere around I want to say like 150, 200,000, and immediately we saw such a high need, and it was being so well perceived, and so many people were asking for it. Luckily, with it being underneath SOAR funds, we were able to increase the budget for more boxes. And then that's where the Alliance, when they have the requests that come in for a box, and also making sure every kind of quadrant of the county is always accounted for and has some boxes in the area. That is of utmost importance. Yes.
Question. In your medication-assisted treatment programs,
Mhm.
do you offer this in vending machines? Because I've seen vending machines across the country offering.
Yes, there are vending machines out there. We are currently not funding vending machines. We do have a partnership with the Oakland County Health Division, and they use their ARPA funds to purchase vending machines. And so in Oakland County, if you see a vending machine, there's a large chance it's probably the health divisions, and they also, the Alliance works closely with the health division to identify, the health division will say, hey, we're looking at putting a vending machine XYZ place. What do you guys think? Were you looking at that? So they're working and talking together, and the Alliance also built their map with the health division's vending machines on there as well, so that way it doesn't matter what somebody is looking for, whether it's the Save a Life box or vending machine, it's all in one spot.
Okay. Thank you.
You're welcome. Yes.
I was just curious, I know you talked about the different areas within Oakland County, but I was wondering, how do you decide the actual location of where you will place the box? Is there a method that you use to say, okay, I'll place it outside of here or versus somewhere else?
I would have to ask the Alliance. I know a lot of what they look at is data, and a lot of what they look at is where is there an extreme need. So, for example, in Pontiac at the Hope Shelter, that was a place where one of the boxes was placed because just simply in looking at where is there a high need, where is there possible use that's going on, where is it that somebody might not be getting access to this at times. So I think that's a lot of what they look at as well. Part of what they have talked to me about as well is there a specific focus? Is it that we should be focusing on getting it into the person's served hands or mom and dad's hands? And I said everyone's hands. I said, so I really want to see across, just a lot of different places. Because, I think the homeless shelter is a great place. I think the MAP providers is a great place. Our MAP population is our population of individual serves that it is a population that can have the most going on. They're the most high risk. A lot of times they can be in active use still. So I think them having access to the fentanyl testing strips and the xylazine testing strips, and then of course the Narcan is huge. And I think then with other placements that they do, I think it's sometimes people reaching out. I think it can also be relationships that are already in place. But I can ask them if they have like a detailed methodology or what that looks like and get you that information. You're welcome.
Are there any other questions? Thank you.
No problem. And we're going to move on to and I'll be quick, don't worry. We're going to move on to the treatment and recovery update timeline. So our goal is to improve the social determinants of health for individuals receiving services. Part of what we are doing, that status is ongoing, partly because what we are doing to address this goal is being utilized under SOAR funds. And because SOAR spans 2 years, we still have funding going for another year. But what we are doing to address that is we are going to be facilitating access to financial housing resources for SUD individuals in our network. So we will hopefully be rolling out by mid-November, beginning of December. We will have a housing assistance program. And so essentially any person who is enrolled at any of our contracted SUD providers will be able to work with their counselor. A lot of times where people struggle with getting back on their feet or becoming successful members of the community is the financial piece and trying to get back on their feet and getting their own place, right? Feeling as though that they are contributing and belonging. And so that first and last month's rent no matter how hard you work, when you're starting off and coming from nothing, that's the hardest part for someone. So they will be able to submit an application to us. Essentially, we just make sure that their counselor has said they're, in the action stage, that they are actively working towards recovery. They have worked on the budget. They understand, we've talked about what it means for them to be moving out on their own. The provider will then act as the person who works with the apartment complex or the housing place, whatever it might be, and the provider will pay that money to that entity for first and last month's rent or utility assistance or whatever it is. So that way the person is able to receive that housing assistance. This program is going to operate under our state opioid response grant. SOAR funds only cover individuals with an opiate use disorder or a stimulant use disorder. So at our last Oversight Policy Board meeting, I had asked the board for approval for use of PA2 funds to cover all individuals, because I am, of course, a fan of what we do for one, we do for all, and they graciously agreed. So we are going to be able to offer this program network-wide. We also have other projects being developed that we would use our ARPA funds for. Things that we have are talking about and looking at is more work and embedding of screeners in the jails or with the courts, or peers embedded more with the court systems. I know Dana has spoken in the past that one of the things that we're looking to do in terms of people accessing our services, we have to get out there and bring it to them. We can't rely on people to come directly to us in order for them to receive our services. So that's being planned right now to see how can we embed more people out into the community for them to be able to access our services more. And especially we're looking around the criminal justice population for that. For quality system of care, enhanced system of care and strengthen provider network to ensure timely access for all eligible populations in Oakland County. So we increased our resources to support and retain our existing workforce. Under our COVID supplemental block grant dollars, we were able to offer financial assistance to all of our treatment providers in terms of training. So each of our treatment providers received $25,000 to put towards any training needs, any certification needs for their staff. I know when I worked at a treatment provider, it cost almost $1,500 for me to get my certified clinical supervisor credential from McBapp. So, and if the provider was not willing to pay for it, which understandably they might not be in a position to be able to do that at all times, that comes out of the clinician's pocket. And so when we're already in a workforce that's struggling and to have people continue to work in the field, for our providers to be able to offer for the peer recovery coaches to pay for their state certification for peer recovery coaching, to pay for the McBapp certifications and the CAC credentials and the CAAD. I'm sorry, I'm using acronyms again. I get excited when I start talking. But for all the credentialing and things that go on, we were able to offer that financial assistance to our providers. Next slide, please. Expand and support integrated health models with our health homes. We have the SUD health home and the opioid health home that are both stood up and going. This fiscal year that we just started, MDHHS wants to see continued enrollments, and quality metrics are going to start to be put in place that are measured. Improved care coordination, Project Assert. I know that for many of you who have had longevity on the board for some time, you have heard, back when Christina Nicholas was here, you have heard her talk about Project Assert. Project Assert is still around. We are working very hard. Obviously, with the pandemic, we had to stop efforts to try to get Project Assert into EDs. I will say, I think one positive that came out of it with the pandemic is I think the hospitals saw the need and continue to see the need that our system, they don't know everything about it, and we are the experts on it, so they are actually being very welcoming in now, and they want to partner with us on Project Assert. I have 2 hospital CEOs. They have MOUs. We are just waiting to see if they are going to be signed. So because they're not signed, I don't want to say the hospitals, but that is further along than we have come in years. So we are very excited that Project Assert continues to hopefully move along, and we can hopefully fingers crossed, have 2 hospitals that are signed on for that. And then lastly, create our new strategic plan. We created our fiscal year 24 through 27 strategic plan at the end of this past fiscal year. It's a long process. It takes us, our last year of the strategic plan, we don't typically have a lot of heavy goals because doing our strategic plan for the next 3 years, it's a very heavy lift. We start in October, the year that it needs to be done, because the first thing we need to do is bring on an agency who's going to help kind of wrangle our needs assessment for us, to kind of do all of our data collecting and running of our groups that we have. And so our report, our new strategic plan, was submitted to, I presented it to the Oversight Policy Board, I believe, in July. It was submitted to MDHHS in August. So we do have our new strategic plan that will be in place for the next 3 years. And I'll be back, I'm sure, next year to give you guys the overview of that. Any questions? Great. Thank you so much.
Next on the agenda is other business. CEO contract.
Thank you. I've been asked to represent our executive committee, which is our chairman, Jonathan Landsman, myself, our vice chair, John Paul Torres, Melchiah Newman, and Adam Furman. So, as you know, we have been working on a new contract for our executive director, or CEO, as a result of the end of her initial 3-year term here at OCHN, and we're very pleased to present to the board. This is an informational item that will be voted on at the board meeting, that contract. So I'm just going to give some highlights, which I think the board members will be interested in, but certainly if there's any other questions, we'll be glad to answer them now or at the board meeting, once you've had a chance to read the complete contract. The first item, and I think an important one, is it is a 5-year contract. The first contract with the CEO was a 3-year contract. I do want to mention, I forgot, we had the very able assistance of outside counsel, Brett Gelbord, who's very experienced and was able to give us comparables in industry, and it is not unusual at all to have a 5-year contract second time around, so to speak. I think what's also important, and for maybe the newer board members, and that includes me, because I came on and Dana was the CEO, but there was a period of time where we had a rapid turnover in a very short period of time in the CEO position. So I think both for our CEO and for the board and the public we serve, the stability of having a 5-year contract is an important item. There is no salary increase contained in the agreement. We recently, as you all know, just went through our CEO evaluation, so that salary stays the same, but the evaluation process will continue and was codified in a more formal sense into the contract. I think we had some feedback from the board about having the chart, and it was modified a little bit just to be very clear, so there wasn't anything that could slip through the cracks. So that performance evaluation that will occur on an annual basis will still remain, and that will be along the line of us as a board individually ranking the CEO on the 12 benchmarks that we previously established for the position. So we also have put into the document, into the contract, the opportunity for a mid-year evaluation, just to let the CEO, for us to have a dialogue and a discussion about how things are going in a more, and do it in a more formal sense. And that was another item that I think came up during some of our discussions as a board on the contract. So there was also clarification of the PTO hours and carryover. We did establish an auto allowance in this contract for the CEO. I might mention that in the prior contract, the 3-year contract, there was an opportunity for an auto allowance, but it was never taken up by the CEO. So it continues what was in the prior contract, but it wasn't acted upon in the prior contract. Now it is being acted upon. So that the one other item I want to mention is that it is a 5-year contract, but there is I don't like to talk about termination provisions, but so the board knows, there is terminations. There's 2 categories. There's without cause, and there is with cause. And the causes are all spelled out in the contract, so there's no confusion. But if the board chooses to terminate the contract without cause, then we would pay the CEO 1-year salary. That is something that is not unusual in these type level contracts, and it kind of gives a little bit of leverage on both sides that we do have a 5-year contract. If for some reason circumstances lead this board or another board to, in the future, to terminate without cause, then there would be the 1-year payment would be in effect. So I also believe that just from a legal viewpoint, we cleared up a lot of things that were in the contract and kind of brought it up to 2023 standards with the help of our outside counsel. And also I would say it wasn't one-sided because Dana was represented by counsel, and I believe overall it was a fairly good exchange. And we had 3 or 4 meetings. I think the executive committee, everybody had an opportunity to speak their piece at the meetings, and so we come to you with that recommendation. I believe, Dana, you've already she's already signed the agreement, so it will be before the board at our next meeting, and that is my summary, subject to any questions anyone may have. Yes.
Add on, that was part of the committee working on the contract, and Dennis gave a very good synopsis of how it went and what we did. Just so the board's aware, it was extensive. We did meet several times. There was a lot of back and forth, and so that we did do our due diligence on this, and I think it was a compromise that came together. The mid-year discussion portion also is something that we added. That way we can get ahead of things if we need to. It's always good, you're not waiting till the time where the evaluation comes and a year has passed. And if there's a pressing issue, a problem, or something good that you're seeing, it allows that opportunity to be able to address that in somewhat of a more formal way, even though it can be an informal process, as it states in the contract. And then the car allowance portion, I understand though, Dennis, that we did that in lieu of mileage reimbursement, correct?
That's correct.
Yeah.
Yes, we did, yeah.
So that was the thing. So now previously our CEO was getting the mileage reimbursement, so this would offset that. So the vehicle allowance, but there will not be the mileage reimbursement. And then I did just have one question when I was looking over it again this afternoon. So for the performance awards and merit increases, it says in here will receive a performance bonus and or a merit increase in her base salary. I thought it was just or, not and.
As I recall, it was
No,
both. It was
both. It was a merit increase and a performance bonus and an annual merit.
Oh, I thought it was one or the other.
She's getting both.
No.
Oh.
No, what it was we didn't have, maybe you might recall, there was, previously, there was the issue about the 2 increases. And
right.
we took one away.
Yeah.
So that was what we ended up with. That's where we ended up at.
So our original agreement that was the 3-year, it was questionable where that came from and how it came about, where it was both a performance bonus and a pay raise. But as well, there was also at that time the organizational pay raises as well.
Right.
So the organizational pay raises are no longer in this agreement.
Right, we took that out.
But these two are a pay raise and as I
Oh,
prefer
I'm
to look
sorry,
at it,
yeah, and I
bonus
misunderstood.
and a
Yeah.
raise.
Okay, it is what I thought it was. I'm sorry, I
Yeah.
misunderstood the merit portion.
Okay.
So we included the two. There was the third, that was the one that we took.
Right.
Okay. No, all right, this is what I thought it
And
was.
it's important to note that one is a performance bonus.
Mhm.
It's on how good of a job she is doing, and then the raise as well is to raise her base
Yeah.
accordingly.
So there'll be the base salary increase and then the bonus based off performance on the
Correct.
evaluations and,
Exactly.
and yeah, I just, I misread that, I'm sorry.
And
Any other question? Any other questions?
the only other point that I wanted to make was,
Okay.
and then I'll pass it over to Christina,
Sure.
is that I felt it was important to move to 5 years from 3. Traditionally, our organization has done 3-year contract extensions when we had Jeff and we had Willie. I mean, it was just, that's just always been history, and I felt we needed to have something that showed our rubber stamp of who we like for our CEO, which is Dana. And so that was our way of just showing, we would continue to do that, but I think 5 years tells the story that we want her, we want to keep her, et cetera. So that's all I have.
I was trying to find in here where like the list of expectations or responsibility was, because in the task contract.
No,
I
it's
have it.
incorporated. If you look in the evaluation section, it does refer to the benchmarks that we previously passed and adopted, and that's incorporated into the agreement. So
You know
the
what
12
page that
items
is?
we evaluate on, those are incorporated by reference to that section, to the guidelines.
I don't know where it is.
Yeah, it's in. Okay, because I just looked at it myself, but let me, yes, it's in section 2.2, where it talks about the benchmarks for the executive director performance in a document entitled, and I quote, Oakland Community Health Network Board Policies Revised and Approved by the OCHN Board on July 28th, 2022.
Okay, but that wasn't attached here, or is it?
No, because it's
Oh, okay.
referred, yeah, it's
Got it.
referenced, so it didn't need to be attached.
Okay, thank
Okay.
you.
Anyone else? So this will be before the full board next week, and on behalf of the executive committee, we would urge our board members to approve it, and we will be here next week to take action. Okay? And I want to thank everybody on the committee, as well as Dana and her council and our council for all the hard work they put in. As John Paul referred, there was a lot of, we had several meetings, there was a lot of back and forth and a lot of hard work. But I think what it establishes for the board, and I think that's very important, is how we govern. And part of that, and the most important thing, is the one employee who reports to us is subject to a pretty comprehensive contract and the expectations. But we know what we're buying, so to speak. You've been here for 3 years, and all of us have had an opportunity to work with you, and we're very pleased that you're going to stay on. Thank you.
Next on our agenda, we have events and outreach with Suzanne.
Good evening, everyone. All of our events and outreach efforts are listed in the packet you have. I'm just going to highlight a few. October has actually been very busy. As you can see, we have quite a few events, actually a couple pages full. I'm just going to highlight that we did host our person served work group appreciation luncheon last week. So our work groups are like CAC, the Citizens Advisory Council, the RRAC, the Recipients' Rights Advisory Council. It was such a successful event. We had probably over 50 people there. Malkaya was in attendance and she provided a few words, so we're thankful for that as well. So it was such a great event, and we always appreciate our work groups and all of the hard work that they do throughout the entire year. So it was a great opportunity to appreciate them. I also wanted to mention the senior forum that was held last week on Friday, and Pastor Jones left, but it was at Welcome Baptist Church, and that was highly attended as well. There were over 75 individuals that attended, and that was Senator Jeremy Moss hosted that event. There were a number of senators. The county executive was there, so it was a very well-attended event. We were excited to be there. Also wanted to mention the Out of the Darkness Suicide Prevention Walk, and that is a highly attended event as well. There are hundreds of individuals participate in that walk, and we were part of that last weekend. Next slide. I also wanted to mention that there is an additional senior forum that is coming up on the 20th of October, and we will also be part of that event, and we expect it to be highly attended as well. So looking forward to that on the 20th. Wanted to mention that we are engaging in a lot of these types of efforts with our legislators. We put out information about the legislative coffee hours each month. As you can see, there are a number of them coming up this month, a couple of them. One of them is happening this evening, and we do have staff there. We also have a couple more coming up. So we are trying to be present, learn more about some of their initiatives, talk about mental health, talk about substance use disorders, and all of the services that OCHN provides. So we're trying to be present and available at those events. As well as at career fairs, our HR team is working very hard to recruit very talented individuals to be part of the OCHN team. And as you can see, they have a number of career fairs coming up for MSU, both Grand Valley as well as CMU. Next slide. As I know many of you are attending the CMHA conference, we also have some staff attending that conference later this month. Also wanted to mention we have a couple of veterans events coming up moving into November. I know it's hard to think of, but time's going by very fast. Coming into November, we have a couple of veterans events coming up, obviously, with it being Veterans Awareness Month. We also have a few staff going to the BOC, Board of Commissioner Health and Safety Committee, presenting about our co-responder initiative that is coming up on November the 7th, and I'm sorry that's not listed. I just found out about that today, so I just wanted to mention that as well. And the next slide. Just wanted to mention some of the press releases that we have going out this month or already gone out. World Mental Health Day is actually tomorrow. We highlighted Mental Health Week, which was last week, and actually for World Mental Health Day, we're looking forward to this. We have our all-staff meeting, and it's actually an anchor day where many of our staff are going to be in. So we're going to be doing a photo of all the staff, all in our OCHN wear, and submitting that to the local media, showing our support for World Mental Health Day. We also put out a co-responder update earlier this month, and we actually are putting another press release out that is not listed, but being that it's Breast Cancer Awareness Month in October, we wanted to highlight mental health concerns related to individuals who might be diagnosed with breast cancer. So we've got that drafted, and we're getting ready to send that out this month. I wanted to talk a little bit about some of the redetermination initiatives. As you know, I've already talked about some of that with the letters that are already going out to the state, from the state, and in addition to those letters that are going out to individuals who need to reapply for Medicaid, OCHN is also sending letters out reminding people, please pay attention to those letters, make sure you're reapplying, that you're ensuring that you're Medicaid eligible. We also are doing a lot with our social media posts, and I wanted to just give you a few stats about some of our social media posts. We've been boosting a lot of information to ensure that individuals receive the information that they need about re-enrolling. And so recently, we actually just did a boost a couple of days ago, and we were able to reach over 2,700 individuals with that boost. And just with even a few more days left with that boost, we've already had over 50 people engaged. So that means that they're reading the information and they're engaging and they're interested in it. I think it was mentioned earlier about some of the outreach that we're doing with Resource and Crisis Center. So we're hosting 2 times a month. I think I mentioned it last month as well. 2 times a month at our Resource and Crisis Center. We're hosting at the RISE Center located in the Resource and Crisis Center, that we're hosting opportunities for individuals to come in to go ahead and go through the process of re-enrolling. So we're walking them through the process. We have staff there, school mental health navigators, as well as some of our other access staff are there to help them go through that process, and so that they're getting enrolled right then and there. And I know I've assisted some people in getting there with transportation, so we have been assisting quite a few people. We've already had 2 events, and we have a couple more coming up this month and 2 more in December. That was all I had. Does anybody have any questions for me? Thank you so much. Okay.
Did we do any of, observation of Disability Employment Month? October is Disability Employment Month?
That is the one press release also that I did not mention. Yes, that is
Okay.
another press release that we are putting out, absolutely. Thank you so much for the reminder.
Thank you.
Thanks.
Next on the agenda is our board calendar review. Talk about the calendar.
So this was reviewed at the COW meeting, so I'm not sure if you guys wanted to pick a date. I kind of highlighted the suggested date, so it really didn't run to 2 meetings in the same week. So this will be up for vote at the next meeting. So I don't know if you guys want to decide on, yes, what date would work better. So those decisions kind of need to be made.
And might I suggest we just work our way through the calendar right now so that we have a tentative calendar to vote on?
Yeah, that works. Yeah.
Okay. So we have, and if you don't mind, I'll moderate it unless someone else has exceptions. All right. I don't see any changes for January. Does anyone have any issues with the January dates of 8th, 16th, and the 25th? I'll give us another 5-second pause as people look at their calendars. Does that look good so far? Okay. Let's move on to the February dates. We've got the 20th, well, we have the 12th, the 20th, and then either the 22nd, 2 days later, or we have February 29th. Is there a Macomb County hosted CMHA?
So that is actually the next topic. So Macomb County is going to go, they're deferring to our date. So they're not going to stick to January if we have to push out a little bit, because they are not able to make the suggested date for October. So I put in there 2 proposed dates for November. So they're kind of waiting for us to decide the November date, and then they'll push theirs out accordingly.
Okay. So in other words, let's just focus on this calendar and keep going, right?
Yeah.
Okay. So would folks prefer the 22nd, so 2 meetings in 1 week, or go to the 29th, the leap year day?
29.
I'll go for the 29th.
I see other heads nodding, or no difference? All right.
No, I agree. I think that all the suggested yellows are good.
Yeah,
I think it's a good range.
Yeah, I'm fine. I concur with John Paul. I think all the suggested dates in yellow are fine.
All right, well then, let's jump up to the May 30th, just to be sure. Anyone with May exceptions? Okay. Then let's jump over to August 29th again. No exceptions, all right. Then we'll jump over to November. Okay, we have 2 in this month. I think the 12th is the normal time that we would have done it anyhow, right?
It is, but it is it's a Tuesday, so not your typical Monday, but note that you're gonna be meeting the Thursday prior on October 31st. If you meet on the second Monday, it just falls, I mean, on the, so November 11th is, Veterans Day. Yeah, so if you go with November 4th, you're just meeting at the study session the week before, and then, yep.
So are we good with a Tuesday committee of the whole meeting?
Right.
All right. Recognizing the following week on a Tuesday, we have the board meeting, and then we have, for Thanksgiving, we have that break, so we have to pull it in early to the 21st.
Yeah,
correct?
because you have Thanksgiving, that 28th is Thanksgiving.
All right. And the last one, we'd be pulling in, study session to the 19th from the 26th, if we do one in December.
Yeah, unless you want it the day after Christmas. Just saying. We normally cancel for December, but,
Well, we've got-
I think the board chose to keep them dates on the calendar, just as a placeholder in case a meeting needed to be held.
Okay. So the other question I wanted to bring up is, are there any dates on this calendar that might have issues with other national holidays or other dates? I know there's none that are related to Judaism. I checked that already too.
Halloween, I think.
Halloween,
But, I mean,
yeah.
I can tell you I'm not gonna be at that meeting because they got a little one, but, you know.
Yeah.
I mean, it's,
Same.
but it's not gonna be perfect, right?
Well,
It's
that's
a
why I
study
brought up
session.
Halloween. That's why I brought up Halloween.
Come in our costumes.
Bring your kid.
All right. Well, this sounds like that you've got your calendar for,
Thank you. It will be approval, so you do have time to look at it. It'll go for approval at the next meeting.
back to the chair.
So here, oh, sorry. Here's the Tri-County meeting. So I looked at the calendar, and November 28th, Tuesday, or November 30th at 6 p.m. It's the same week. You don't have any other board meeting in that week.
And you said Macomb could make the 30th?
Macomb could not make the 30th. And then I was keeping, October, yep. Because we suggested having our October study session go to the Tri-County, but they're not able, they already have a prior commitment. So I looked at our calendar, and those are the two, noting that this is election month too, so we wanted to keep away from that first week. So this is the only suggestive alternative that I could see on the calendar.
All right, and they didn't have issues with November 30th, correct?
They told us to come up back with a date, so I figured we could propose 2 dates,
Okay.
so,
They just had the issues with October.
and, yeah, and the first week in November.
Right. Well, they're a county organization.
Yeah.
How do folks feel about keeping these on Thursdays?
Yeah, I think so.
I'm seeing a lot of heads
I
up.
think it keeps
so-
it consistent, yeah.
Yeah. And we could look at, if you didn't want a November Saturday session, you could take place over this, but just push it out a week.
Well, we've got a little bit of time, but we need to communicate that over to,
Right.
to both of those, and Detroit Wayne as well as Macomb.
Yeah.
But it sounds like for those in attendance here, the November 30th sounds like it's okay.
Okay, so I can go back to Macomb and Wayne and propose the 30th and the 28th as an alternative. So that way we could cover. Okay.
Thank you.
Thank you, Sheila.
Kaya, back to you.
Next is our next opportunity for public comment. Is there anyone online that would like to make public comment?
Yes, we do have an individual online that would like to make public comment. Zachary Cardinal.
Hi, everyone. Thanks for the chance to speak with you this evening. It's been a while, so I hope everyone's doing all right. My name is Zach Cardinell. I'm a new Gateways board member, an ARC of Michigan board member, an OCHN CAC member, and I'm currently contracting with Easter Seals MORC's training department. I'm making public comment tonight because I'm absolutely shattered and disappointed after the announcement of the elimination of the $1 wage increase to DSPs, as well as the vocational rates not being addressed before ending of the cost reimbursement. Ending cost reimbursement before addressing the prehistoric rate structure will cripple some providers, which this has been communicated with OCHN. Skill building rates are essentially the same as they have been for over a decade. And many vocational providers also maintain a wait list, which I know that everyone's aware of. And unfortunately, it's a shocking amount of those folks on the wait list have been on the wait list for over 2 years. So ending reimbursement will dismantle some providers, putting the burden of support on many of the other struggling providers, and worse yet, folks receiving support will have less choice and control over their support. They will be stuck at home, completely disengaged. But we know who the engine in all this is, and that's the direct support professionals. They are truly the only group of people in our sector keeping things going. You or I can lose our position in the system, and things will move along as if we were never here. The direct support professionals are the ones that take with them the memories, compassion, and the heartbreak. OCHN has done a great job over the past few years advocating and making commitments to fair wages for DSPs, which I truly thank you, and I speak for hundreds of DSPs that I've been so lucky to work with. I truly thank you for the work that you guys have done, but we can't continue to, we can't wait for another global pandemic in order to be reminded of how critical this workforce is. So I'm asking that you please continue cost reimbursement until the rate structure can be appropriately addressed, and please reinstate the $1 wage increase for DSPs alongside with the MDHHS mandated 85-cent pass-through. Thank you.
Thank you, Mr. Cardinelli. You will be receiving a written response from our customer service department. Is there anyone in the building that would like to make public comment at this time? Not seeing anyone. We're going to board member comments. Can you call the roll?
Ms. Root? All of this in front of us about the direct care wage change, is this related to our presentation about the survey results and the, okay. So I think I'd like to talk through this more if we can maybe at some point, because this is a lot in front of us and we're hearing a lot from the public, so I want to make sure the board, you know, is having a conversation about it. That's all. Thank you.
No comment.
Mr. Torres?
Yeah, I'm looking at all these comments that we received. I think I counted about 50 of them altogether, written comments, public comments on the direct care wage situation. I know we had the presentation at the study session last month, and I still have some questions because I left and I think a few of us left, you know, scratching our heads because I think the reasoning is that we were expecting to see a decrease in calls and incidents, but we saw an increase. But I think the point was made that that may have been because we had a more stable workforce based off of the increase in the wages. So I'm just not sure that our reasoning was correct. I'm feeling like it may have been a bit flawed. Because I think it may have been a good thing that we were seeing that increase in the calls and the incidents. And I know we were using that as the premise to say we were going to end the increase. So, you know, I'd like to see that maybe on the agenda, brought back up. Because it's not something, or is it something that we are actually voting on as a board, or was that
So a couple things. The two items are unrelated. The presentation had to do with the direct care wage pilot, which was, I believe, 11 homes over 5 providers. And the increase in the incidence, as I put in the slideshow, that wasn't the only reason it was ended. As I mentioned at the time, there was overall inconclusive results showing that there was any type of improvement, any noted improvement overall. And I also provided the budget numbers that it would take to continue that. And if you remember, I don't remember the exact number, but it was significant if we were going to continue that. So for the budget reasons and the lack of improvement, those were some of the reasons why it was not continued. And I think I missed your last question. I'm sorry.
Oh, well, I think that that was the question, though. I think the lack of improvement, but, you know, one could say the improvement was the increase in calls and incidents. And that was where I kind of was scratching my head, because when you were talking through the presentation, and I know this is supposed to be board member comments, so we don't have to have a back and forth, but I was just raising that issue that I felt that the improvement may have been that we've seen the increase in calls and incidents, and that those were incidents, situations that weren't being brought to the attention previously before.
And you did also mention a final wrap-up on it, and that's one part as well that we're going to be doing, because we needed the last quarter of data, and we'll also be doing the 6-month post review. So we'll be able to provide a full summary of the project.
Yeah, I would just like to see more information on it, because I don't think I'm completely sold. I had questions when I left.
Be happy to provide more information.
Thank you.
That's me. Sorry. Mr. Cowan?
I don't have any comments.
Mr. Landsman?
No comments this evening. Thank
Mr. Young?
Just to follow up on first of all, I think the social media and the general communication on the redetermination is good. Also, at the study session, we talked about reaching out to the insurance companies and matching the lists. I think we need to do that, because I run into too many people, or people know I'm on the board and seek me out, who are unsure of where they are at, and reaching back up to the state or the website or any of that is not helpful. So for our own financial viability, I think the general piece is good, but I think we got to get down into the roots. Or I'll use my own self as an example. I have no clue when Joseph Young is up. And if I don't, I can imagine there's another 100,000 people out there who have absolutely no clue and can't navigate that website, which, when it's up, is only partially helpful. I'm not talking about ours, I'm talking about the state.
Ms. Woodruff?
No comment.
Ms. Newman?
No comments. And with that, unless I have something from someone else, the meeting stands adjourned.